Chiropractic is actually a very non-invasive form of healing for folks, also holistic like the acupuncture. It's been around for a long time. There are references of spinal manipulation in China going back 2,700 years. In Greece, there's references made as long as 1,500 years ago. The current model that we use for chiropractic on patients has been around in the United States a little over 115. Doctors of chiropractic are well educated. It's one of the questions people say, well, how do you compare to a real doctor? Which is always interesting. But we have about 4,200 hours in the minimum program, in the minimal schools of education between classroom, laboratory, and clinical settings. The theory in chiropractic is that when the spine is in normal alignment, the brain can connect with the peripheral nerves and let the body function optimally. What happens when you have a subluxation, or what they call a myofascial adhesion, limited muscle movement and injury, you impede that flow. The nerves get compression and they can't do what they're supposed to do. What winds up happening is you can have back pain, you can have limited range of motion, you can have internal disorders like gut pathology and bedwetting in children. And chiropractic can help all of these without ever having to do anything invasive to the patient. I've had some interesting cases with chiropractic. I had a professor at a local university, he was a department head, that had injured his back and was to the point where he couldn't even do his lectures without taking medications. He's not the type of doctor that prescribes heavily. He tries to stay away from that. And in order just to be able to run his lecture series, he had to heavily medicate. So we got in, we did a few treatments. We tried some different techniques within chiropractic. There's not just straight spinal adjusting. There's flexion distraction, there's toggle technique, there's a multitude of techniques you can use. And through several of these techniques, we got him back on his feet in about 4 weeks. He no longer medicates, and he's one of my greatest referrals for patients. I had another individual who had something called torticollis. Something causes the neck, whether it's trauma, whether it's drugs, to make the head get stuck in a rigid position. They're only able to turn partially to one direction or another. I took this patient on. He had suffered the condition. It came on after one night of being out. He woke up in the morning and he wasn't able to move his head. He'd suffered for about 7 years with it. I treated him for approximately 3 months. We were able to restore about 75% of his range of motion. So that's key. I mean, you need to see where you're going when you're driving. You need to be able to function properly in your life. So it's another instance where chiropractic was very beneficial.